And on a national level, state, or rather health officials are saying they're seeing a sharper increase in cases over a shorter amount of time. 60, or rather the dark red map here, the dark red on the map representing where cases are surging most. Dr. Deborah Birx says that these numbers are climbing so fast because of cold weather in parts of the country that drove people indoors. All of this with Thanksgiving just a week away, and the CDC saying the safest thing to do is stay home. CBS 2's Jessica Layton has the story.
During the first briefing of the White House Coronavirus Task Force in 4 months, the experts took no questions, but they cautioned that the rapid spread of COVID is coming from patients, friends, and family members who have no symptoms.
We just assume that if you look okay, you are okay. And now we know that over 50% of the individuals, particularly among those under 35, many could be infected and unknowingly spreading the virus.
That message on the same day the CDC sent out its own urgent warning: cancel Thanksgiving plans and do not travel at all unless you've quarantined for 14 days. On Friday, Pfizer is expected to apply for emergency use authorization from the FDA for its vaccine.
EUA comes. 24 hours later, vaccines will be distributed out to the American people.
Dr. Anthony Fauci addressed concerns of those who worry the vaccine has been rushed.
The process of the speed did not compromise at all safety, nor did it compromise scientific integrity. It was a reflection of the extraordinary scientific advances in these types of vaccines.
Across the country, COVID hospitalizations are up 100% in the last month. This facility in Reno, Nevada is now resorting to setting up beds in a parking garage. And nationwide, there are cries over the desperate lack of PPE, including masks. This map shows several states with less than a month's supply.
I just don't understand how the things that we learned in New York City couldn't get translated across the country.
Judy Sheridan-Gonzalez is a longtime ER nurse at Montefiore Medical Center in the Bronx, a community that was devastated by this disease in the spring.
And knowing that it could be repeated again.
Yeah, people are freaking out. Be honest with you.
Thursday, nurses at Montefiore marched in protest of staffing shortages and not being prepared for the pandemic's second wave.
They don't have enough negative pressure rooms. The HEPA filters look like they were taken out of a dumpster. We're terrified that if COVID really surges, that we'll be in danger again.
And a spokesperson here at Montefiore Medical Center says they have a stockpile of PPE that will last them at least 90 days, as required by the state. In fact, all the hospitals we spoke with in both New York and New Jersey tonight said the same, hoping, of course, they will not have to use any of it. We're live in the Norwood section of the Bronx tonight. Jessica Layton, CBS 2 News.
Okay, Jessica.